Hi, my name is Eva Steiner, and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to... Thank you for taking your time for doing this interview with me. I am looking forward for today, but before we start, can you tell me a little bit about yourself?
Okay, so my name is Andrea Lasnik-Amit, and I am a clinical psychologist in Israel and a psychotherapist in Canada. And I work mainly with adults, but also adolescents. And I work online and in person. My orientation is psychodynamic, though not so much the classical psychodynamic, but ISTDP, so the intensive psychodynamic orientation. And I really enjoy my job. I'm very interested in people, and I like their life stories and hearing them speak and how they speak. And I love languages and reading. I have 2 children, grown up at the moment, students in university.
Nice. Okay, so can you tell me a little bit about your culture? What are some holidays or traditions that your country celebrates? And if your culture would be an emotion, what emotion would it be?
Okay, so today when we do the interview, it's our New Year's.
Oh, nice.
Yeah, so I used to celebrate Jewish holidays. So this is the beginning of the Jewish year. I don't celebrate it so much in Canada anymore, but when I was living in Israel up until 10 years ago, so it was kind of a family celebration, a family gathering. And here I don't have family, and I don't have a Jewish community around, so I'm not doing that anymore. So I don't feel like I carried the culture this way with me. I also felt sometimes a bit strange because it's more on the religious side. And for me, keeping the culture is more through the language and the literature, and not so much through the holidays. Even though there was a special atmosphere, I really liked it. So the next holiday after New Year's, it's a Yom Kippur, so the pardon day. And it was very special because there were no buses or cars running, and the kids were out with their bicycles, and they would, go on the freeway with bicycles. So even if you weren't religious, it was really nice. If you were religious, some people fast. I don't. But I enjoy the silence and the tranquility of that day, that suddenly everything stops. Of course, no shops, no cars, and everything slows down. So I really miss that day in that sense, not in the secular sense, not in the religious sense. And I was thinking about that question of emotion. So if you're talking about the country, so I think the country of Israel, the emotion would be anger. And it's a very hectic and high tension culture, everyday culture. But not so much the written culture, let's say. I would say there is also something in the written culture of memory and desire for the past. I make this distinction between the written culture and the everyday culture.
And what would be the second emotion then?
Memory and desire.
Memory and desire.
Yeah. but the first one would be anger.
Yeah.
Yeah.
Okay. So how did you become a psychotherapist in Israel, and what is your therapeutic approach?
So I have a first degree in psychology and literature, minor literature, major psychology.
Mm-hmm.
And then I continued to clinical and educational psychology of the child in the same university, in the Hebrew University of Jerusalem. The process is that you have to go, apart from taking into consideration the average of your marks, you have to go through 2 interviews, in-depth interviews, because at least when I learned, that was like in the 90s, so around 30 years ago, the orientation was very psychodynamic.
Mm-hmm.
And you also had to do some kind of volunteer work. And after you finish your second degree, the master's degree, and then you have 4 years of supervised practice. So it means that you have to go through certain hours of treating different people with different problems, and also going through the diagnostic batteries, which is also psychodynamically oriented. So it included the Rorschach, if you know
Mm-hmm. Yeah.
what it is, and also the number of supervised of the supervision was calculated. It was personal supervision and group supervision, and in 2 settings. So half of the 4 years were in a clinic with adolescents, and the other 2 years in a day hospital for adults in different types of crisis in their lives that were usually hospitalized there between 6 months and a year.
Mm-hmm.
But it was a day hospital, so they would go and come.
Mm-hmm. And regarding the approach, how do you choose the approach? Is psychodynamic because they taught you that in the university, or you can choose at some point what type of approach do you want?
They taught me that at university, but that's why I wanted to be a psychologist.
Mm-hmm.
So because I like that approach, I think it's a deep approach that
Mm-hmm.
takes into consideration not only what you see, the symptoms, but what they are related to. And I think that in face of culture that wants to explain everything by biology and hormones, and it's a bit dehumanizing. And
Yes.
I find that looking at inner conflict usually help people most, and help them take control over their life, because some of these things are in their control if they know about them better, if they don't relinquish the possibility to know something that they don't know yet. And if you explain everything by biology, so you have no way to change it but medications, and they didn't prove themselves that well, the medications. And I suppose, of course, you can choose. Some people maybe later on in their life specialize in narrative therapy, CBT. I took some courses in CBT as well. And also I specialized, or in the last 2 or 3 years, in the more intensive way of the dynamic theory that I believe addresses better the dismantling of defense mechanisms that I think for most people is very important in order to get to look at their conflicts. And of course, with different people, you do it in different ways. But that was a modality I chose after being educated in the more classical approach that takes a lot of time, and that you are cautious and you don't deal directly with people's defense mechanisms. You let them be for a while.
Yeah. Is there any other way you can become a psychotherapist in Israel?
No, you don't need to be only a psychologist. You can be a social worker, and also but you always need a master's degree. So you can be a social worker. I don't think, maybe change, but at my time, there was no psychotherapy career. It was only psychology or social work, and also psychiatrists could go to the school of psychotherapy and become psychotherapists apart from doctors.
And do you feel there is a lot of education option in Israel regarding psychotherapy, psychology?
So again, I'm talking about many years ago, because I don't know. I think it has changed, because in my time it was quite limited, not enough. And I know that they opened new universities with new options to become a psychotherapist, because there was a need for that. There is still a need for that, especially after COVID.
Yeah.
So yes, so I think there are at least 3 new universities that added this type of training. And maybe also they added psychotherapy, but I don't know about that.
Okay. How society looks upon psychotherapy or any psychological help?
In Israel, I think it's quite popular and not a source of shame or something like that. It's not as popular as the country I'm coming from. I was born in Argentina. So if I could put it on a scale, Argentina is really, at least in Buenos Aires, where I come from. So even if you don't have a problem, you're supposed to know yourself better. So everybody is in psychoanalytic psychotherapy. So Israel, it is a bit less. And Canada, it's much, much less. So that's why I'm comparing. So Israel is in a good place in the middle. So I think it is accepted, welcomed, and people use it quite often. Men can talk about that in social settings. So yes, no problem.
Okay. And what did you mean? Like in Canada, there is like openness, or in Argentina, there is openness? I think I misunderstood.
No, I said Argentina is the most open, then Israel, then Canada is the less.
Interesting. Can you elaborate a little bit more?
Yes, I think at least in Buenos Aires, it's part of the culture. That's what I'm saying. You don't need to have a special problem to be in psychotherapy, but it's more popular, it's less expensive, and it's in the reach of most people wallet, let's say. And people, I think, enjoy it. And it's part of everyday thinking about unconscious conflicts, let's say, or that at least in a certain circle, I'm talking about middle class in a big city, in Buenos Aires, it's like that.
Interesting.
And yeah, and I mean, for example, there are many psychologists in my family, so we could talk about a dream in a family dinner, and everybody would contribute, and nobody is ashamed of that, and they bring what my psychologist said, what this said, and things like that. In Israel, it's not so much, in the sense that people that have problem would go to a psychologist, no problem, and would talk about it. But not people just for curiosity about themselves. No. In that sense, they are open, but a bit less than in Argentina. And that won't be, a conversation in a big context. Maybe to your best friend or friends, you would talk about it, but not in a dinner, I wouldn't say. And in Canada, what I observe is that people neglect themselves a little bit. I mean, they will arrive to therapy when their problems are crippling. Yeah. So that's why I'm saying that there is this difference. So, and sometimes with feelings of shame or failure that they have to be in therapy.
Yeah. Okay. So the fourth question, what is your society teaching about child-parent relationship and whether these values influence how you design your interventions?
Okay, so if we're talking about Israel, so kids are very important. The mortality in Israel is one of the highest in the Western world, and it's like an entrance ticket to society. And we see that even gay people have children. So family and children are extremely, extremely important. And families are usually very tight, sometimes too tight. So you see problems of enmeshment. But I'm also thinking that it's not only what society teaches, but what my psychodynamic thought teaches me is that children are many times the identified patient of the family, the IP. So it means that their problems are maybe a reflection or something that is coming to the surface that is happening in the family or within the adults. So usually, for example, if you have a child with behavioral problems or violence, so then we can maybe start asking or thinking about how the parents are approaching anger issues and what is of anger in the family. And I think that concerning educational practices in Israel, so I would say that at least in not the immigrant population, but the population I was exposed to, like middle class, and there is a lot of emphasis on excellence and expectations, and not so much, I would say, and I'm generalizing, of course, and there are families that are an exception to it, but I would say that the excellence sometimes comes first before maybe empathy or respect or politeness to others or taking them into consideration.
For example, what if an adult client would come to you and say, I want to cut ties with my parents? How would you approach?
Okay, so this is still a rare complaint, but it depends. Sometimes in cases of abuse, and that there is a toxic relationship still going on, that the person tried to put up boundaries and things like that, and it didn't work out. So if this is what they want, so of course they have the right to do that, and I will help them with that. In other cases, so when there is not a toxic relationship, but there are some types of hurts, like maybe in any family, that can be hurts, misunderstandings, limitations of the parents. So maybe I would help that person be in touch with complex feelings or mixed feelings towards the parents, because if there is not a history of abuse, that could indicate that the person is splitting or having just a black and white view of things, not a complex view of things. So then I may help them to see it in a more complex way. But anyhow, the definitive solution is the patients. So they decide how they want to act. Therapy is not so much about how to act, but understanding why people choose what they choose, And of course, that I don't have a better view or a better understanding of what's the right choice, but I can understand from the patient's narrative what is detrimental for them, what they have tried and didn't work, or what choices they did that were poor choices or that damaged them. Okay, so this is still a rare complaint, but it depends. Sometimes in cases of abuse, and that there is a toxic relationship still going on, and that the person tried to put up boundaries and things like that, and it didn't work out. So if this is what they want, so of course they have the right to do that, and I will help them with that. In other cases, so when there is not a toxic relationship, but there are some types of hurts, like maybe in any family, that can be hurts, misunderstandings, limitations of the parents. So maybe I would help that person be in touch with complex feelings or mixed feelings towards the parents, because if there is not a history of abuse, that could indicate that the person is splitting or having just a black and white view of things, not a complex view of things. So then I may help them to see it in a more complex way. But anyhow, the definitive solution is the patient's. So they decide how they want to act. Therapy is not so much about how to act, but understanding why people choose what they choose. And of course, that I don't have a better view or a better understanding of what's the right choice, but I can understand from the patient's narrative what is detrimental for them, what they have tried and didn't work, or what choices they did that were poor choices or that damaged them.
So what are the learned beliefs regarding client-therapy relationship, and can the relationship continue outside the therapy once the therapy process is over?
The second part is a no, a big no. It cannot continue. It's not ethical, not friendship, of course, not romantic relationship, nothing like that. And the client-psychologist relationship is not very formal, as most of the relationship in Israel are not very formal. Mm-hmm. But we look at transference like in any other psychotherapeutic relationship. So what is happening with the psychologist or the psychotherapist can tell us a lot about patterns of attachment and aggressiveness or love. And you deal with all this in the session in language, not ever acting out. Mm-hmm. But the way I see it, working with transference is extremely important. There cannot be a therapeutic alliance without it. I find that I love my clients and I am highly invested in them. And I know I'm not the only one. I know that also from my own therapies with people, that in Israel, psychologists are really, really invested and you can feel close. That's also part of the general culture, I think, of not being very formal. So you would give all your clients your phone number. If there is an emergency, they can call you, then they can text you. Rarely I had to put boundaries, but I know sometimes people have to put boundaries when someone is calling a lot. This is not, for example, something you do here in Canada. You never give, at least in the public institution I work, you never give your clients your personal phone number.
Mm-hmm.
And so the relationship is more formal, and you feel it on all levels, not only as therapist and client and patient, but also when you deal with other professionals here.
I wanted to actually ask about this formal, informal relationship. Can you maybe elaborate a little bit more?
I think that I don't know how to elaborate on this. I'm just feeling that I felt that in Israel, the relationships are usually less formal,
Mm-hmm.
and people are more approachable. And even though there is a lot of impatience, but you really know where you're standing. So if someone likes you, you know it. If someone doesn't like you, you know it as well. Here in Canada, I find that it's difficult to know because everybody is formal but nice. So there is something comforting about it because there is more the human relations on a superficial level are more calm in Canada and more tranquil. But when you want to dip a little bit deeper, you don't know anymore if the kindness is a part of something general, or the kindness or niceness, or they just like you. So in that sense, I'm a bit confused here. In Israel, you would know exactly because if they don't like you, they discard you. They won't be nice, just to be human.
Yeah.
Only if they like you. So it's uncomfortable sometimes on a day-to-day basis interactions. But when you want to deepen the relationship into friendship, you know where you're standing.
Yeah, that would be easier for me.
Yeah. So I just got used to it. I suppose that people that are not used to it will find it difficult because there is some rudeness to when somebody, I don't think people in Israel think they have to treat you with respect if they don't like you, just because you're a human being. And here they do.
Okay, the sixth question is supervision a must for a therapist in your country?
Yes, on the 4 first years, it's a must. And you have to accumulate certain hours of supervision. But after that, it's not a must, but most people do take it.
Yeah.
And I myself, I still supervise people from Israel. And I myself, I'm taking supervision, not on a constant rhythm as I used to do when I was on a supervised practice, but when I feel I need. And sometimes I join a supervision group that runs for 6 months or something like that. So you are expected to evolve and to learn, but there are no special standards in Israel that say how much you have to learn and evolve. But people do that because psychologists and psychotherapists in general are a curious group of people. Here in Canada, it is quantified. So you are supposed to have 20 hours after your supervised practice, you're supposed to have 20 hours of learning experiences per year. And half of them should be experiential, meaning some type of supervision, and half of them more intellectual and conferences and things like that.
So what are the most common complaints that a client comes to therapy for?
So I would say depression and anxiety. Sometimes anxiety is related to traumas as well. They are very common, and this would be the flu of the psychology, right? Depression and anxiety. So yes, most people are coming with these complaints, and these complaints are really have a good outcome in psychotherapy. And I am not talking about long-lasting depression of years that would require longer work, or if it's a depression, you know, in a frame of some personality issues and attachment issues. But usually if it's an episode, then it's easy to help, and also with anxiety. And yeah. And usually I feel like I have good results with that in therapy.
If you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
First of all, that we are very complex creatures, the human beings, and then there is a big part of what drives us that we don't know about, and that it is super interesting to dive in and to see what's there. I know that sometimes people are anxious about it, but if we turn this anxiety into curiosity about what's going on in those areas that we don't know anything about, it is really fun finding out. It can be also painful, but in general terms, it can benefit us. So really thank you for taking this time, for doing this interview with me. For me, it was really nice to hear all three aspects, or all aspects from all three countries.